Mango strawberry waffles. I don't know if anybody will be able to hear you talking about whatever you wanted to talk.
We got this soundtrack in the background. It seems like every
It's going
other
on forever.
time
Yeah.
Some people doing some painting.
We haven't been able to do deck dinner. We've been doing deck breakfast for the most part, but
yeah, because they arrived late. I don't know what sort of schedule they're following. We're not going to say what they're exactly painting, but they're using a skyjack. And, well, half the working days they don't even use it. It's just sitting there unused. They could have got this the annoyance over and done with a long time ago. Anyway, you got anything else to talk about?
Can you imagine what it's like being in that apartment building? God.
I kind of can, but it's never quite the same. People can imagine the kind of bother I have with my back, but it's almost impossible to tell. One doctor said he'd never seen so much damage or so few complications. But there are complications. 5 fractured vertebrae, compression fractures. They're not quite the same thing as getting things sheared or whatever. But that ain't fun. It's hard for people to understand how limiting it is. And by times, relatively painful. Anyway, do you have anything to talk about, good, bad, indifferent, aside from
we're out here because
the
you wanted to
incompetent
come
data?
out.
Yeah, exactly. Okay. This day should be cause for celebration for another 4 weeks. I went down to the hospital today. Chinook Regional Hospital, COH, I think. Initial is in that too. And I got a clean bill of health and also indication that my immune system is well enough for me to take another treatment for my multiple myeloma. But it's hard to celebrate when your employees, and yes, healthcare, so-called professionals, so many of you are unprofessionals, you are my employees. When someone pays your wages, you're their employee. Do you get that straight? You're my employees. And when you've got signs all over the place, treat people here with respect. Respect is a two-way street. And I'm getting tired of getting disrespected over at the Chinook Regional Health Center. That's here in Lethbridge. I am tired of it. I'm tired. There are some nice security guards there, but there's some nasty ones. Stupid people. Didn't even get a C average in high school. They've got their criminal justice training, or they're trying to get it, or they got their dreams about being a cop, and they have to handle security. And there are so many of them, not all of them, are dumb. I'm tired. That's where it starts. Then the people doing the screening. I don't know if they're nurses or what. Today it was a nurse.
Alfred?
Today it was a nurse or someone doing the screening. So I go to the person who, there were 3 people waiting. She motions me over. She's a nice enough person. I'm explaining why my voice sounds as though I'm stuffed up. Doesn't sound like I'm stuffed up now, but when I put a mask on, it's stuffed up. Why is that? Well, the masks they issued there, and most of the masks you see out there have a metal thing on them. That's why if you look at my nose, you'll see I have a permanent wound there. I have to go and mask up minimum 3 times a week. Going to the Chinook Regional Health Center. Once a week, a month. 3 times a month. Once a month to the community lab, get my blood drawn. Once a month to go through my monthly checkup, and once a month to get my treatment. Great. Now that's why I got my immune system is lowered because of the treatments I take, one chemo, one monoclonal antibodies, which I'm told isn't exactly a chemo, and then just the fact that I've got cancer, and the particular type of cancer I've got, multiple myeloma, that's bone marrow cancer. That's where you basically develop your immune system. So anytime I get a little wound on my skin, it takes a little while to heal. That's why I've got this on my nose. That's from the masks. And so what I do is, to avoid the mask from sliding up and down, I pinch it on tight. So I'm explaining to the nurse there, is very nice. Like, we've gone through this before. Like about 2 months ago, I got inside, and the nurse inside the cancer center was saying, "You sound stuffed up." And I was explaining to her, like it had been a little cool in the morning and stuff like that. So I got a little bit of congestion walking down in the 10 minutes. And later on, she said, "You said you had a cold." What? That's just an outright lie, or an outright misrepresentation. I told her I'd got a little bit of a runny nose in the 10 minutes it took me to walk 4 blocks. And you're saying, "Well, that's pretty slow. You're making that up about the 10 minutes. I've got 5 fractured vertebrae. Sometimes it takes me 15 minutes. So don't start making this straw man out of me. I don't exaggerate numbers. I try not to exaggerate anything. So I'm explaining why I didn't have any, what happened was that I had to pull down my mask, go through the swab, and of course I was saying, well, if you have to do it, you don't have to, because it's not something that when I left my place, I was congested. If it's COVID, it came on me in the 10 minutes it took to walk here, the hospital. And, they tested me. "Oh, you're free and clear." And I'm sitting there thinking, you guys aren't free and clear. Because I told you, I don't get respected. It's been that way with the medical profession for more than 10 years, 20 years.
If they're testing you when you're not sick, then presumably they're testing other people.
I want consistency. If they're going to be that anal about it, I want consistency. So what happened today is, I'm explaining to all of a sudden this big fat English woman who thinks she's the Empress of the British Empire. The sun has set, in case you're watching Fatso. The sun has set on the British Empire. And you're not my Empress. Okay? The sun has set. I'm tired of you Brits. Not Brits, you English folk, coming over here and thinking you still rule us. That started ending in 1867, is followed up in 1931, I believe, and finalized when we got our own constitution. I think that was in 1980. You don't rule over us. You give up your imperiousness. You understand, you big fat empress of nothing? So she barges in and said, "You've got to answer all the questions." I'm going, wow. I always say, ask me all the questions. Ask me all the questions. Because you should be asking. They slough through. You say no to all the symptoms, they'll do that with people. Sometimes they'll try that with me, and I say, you should ask me all the questions. You see how she set up a straw man? All she was looking to do was throw her weight around. Her substantial weight around. Big fat pig. No, pigs are nicer than you. Pigs are nice people, according to Pauline. So,
well, it depends on the pig.
Yeah, exactly right. You got to watch out for the boars and stuff like that. So what I'm looking for is consistency. If they're going to hard buttock me this way, I want to see consistency. The last 3 times I've been in for treatment, and I'm in for what, 2 hours? 2.5 hours, something like that. 2 of the 3 times, there have been people sitting in the same area as me, within breathing distance. It's not within antisocial distance, but it's within breathing distance. They're there for sometimes hours on end. I'm there for hours on end, and I see someone with their mask down getting treatment while they're chowing down. Now, I understand, I've been there. When you're taking certain types of chemos, in my case it was taking painkillers, which I'm not on anymore and haven't been on for 10 years or thereabouts, almost 10 years. You suffer from nausea, and so if you can get some food into someone in that situation when they've got cancer, okay, I can see having the mask taken down. Strictly speaking, it shouldn't be happening in a cancer center, but okay. But visitors shouldn't be allowed in there. I don't know who's allowed that to happen. I think it comes from the province. Okay. Visitors are allowed, but they should not be allowed to eat or drink in that place where cancer patients are, where they're being treated. Sometimes for hours. Unacceptable. And 2 of the last 3 times I've been down there, there have been visitors there with their masks down. In the last case, it was mask down eating. Hey, if you're a visitor, you show some. I mean, really, the hospital should be telling people, don't do that. But if you're a visitor, you'd never do that. If you had any consideration for anyone else there, you would, if you were feeling hungry, you'd go out into the hallway or into the cafeteria and chow down, not in the cancer center. Everyone there who's getting treated, they've got trouble with their immune system. Rude. And in the first time, 3 months ago, the visitor, a woman, was drinking. Okay, she's drinking some stuff. Bit of an excuse. She should have gone to the cafeteria to do that. She wanted to do it at the hospital. Shouldn't take her that long. She can get back and comfort whoever she's with. But then, after that, she pulls out her laptop, and I guess she can't see her laptop clearly enough with her mask on, so she's got her mask hanging down by one ear, dangling down, working away at the laptop. That's the visitor. Unacceptable. Both times I whisper to the nurse who's taking care of me, different nurses, hey, you see that? Shh. Well, I'm being quiet. I should be raising an issue out loud. Unacceptable. I can draw the curtains around you, not around them. You. That happened both. What? It's an issue not just for me, but for society. This can't be allowed to happen.
I know.
So what I'm looking for is consistency. I am looking for consistency, which is, if they're going to hard buttock me, why aren't they hard buttocking them? No, well, I get disrespected both times. They're treating me as though I'm naked, and I'm whispering, making a huge unnecessary fuss. See, I get disrespected because I get exposed to this sort of stuff. Then I go in there, and I'm the perfect patient when I go in there. Ask me all the questions. Don't slough me on through. Okay, what were you going to say?
I was going to say that what they are doing is not acceptable, but I know what they're doing. See, when I was a weed inspector, a job which I did not really want to do. But
you did that 2 years in a row?
Yeah, I did. But anyway, I was tired of people calling in a complaint about their neighbor or whatever and having to go deal with it. Or, people talking about, oh, it's, coming from them and whatever. And it's like, okay, maybe it is. And
in other words, they've got weeds and they're saying it's coming in from up.
So eventually I decided, okay, anytime somebody's going to call, I'm looking at their property as well as the neighbors. And they're getting the same. I'm not just going to go to the neighbors and do a weed inspection. I'm going to do theirs too.
Sure.
So, which I'm sure really thrilled them. But, so what's happening with my assumption of what's happening with the hospital personnel and you is you have raised a fuss a lot of times, complaining about them not doing an adequate job of trying to protect patients. And you're right, but they've now decided, rather than focus on enforcing the rules with other patients, which they weren't doing in the first place, they're just going to focus on you.
Because, you see, like I asked the woman who was next to this uppity nurse, who is this person? She didn't know.
Well,
don't
it might
see.
have got around. Word might have got around about you.
You don't see the same people. It's always different. You don't have to identify yourself by name.
Oh, well,
You're wearing the mask. You don't see. You see what I'm saying?
Well,
I'd never seen this fat empress of India before.
Okay, well, honestly, that might actually be a positive thing then.
What do you mean?
Well, if she doesn't know you and she's treating you like crap, maybe she's treating other people like crap too about this, and maybe some safety health standards will actually be raised with other people. Do you see what I'm saying?
It's got to be consistent.
Well, it might be.
It's not. It's got to be consistent with everyone. Everyone's got to be on board. They've got to ask the same questions, go through the rigmarole.
Well, I think you're right. I mean, they're just gonna. What's gonna happen is they're just gonna throw away all the safety.
I was in there once. There was a person didn't have their mask on. They're sniffling and snuffling in the treatment area. She was there for over an hour before a nurse came over and said, "You're going to have to put your mask up. Not you got to get out of here or get a test." I come in, I've got congestion, I'm not coughing and hacking and snuffling and sneezing, and I got to go through the swab. And I told them. And then the person is lying later on the phone or making it up or something, dreaming in Technicolor. Maybe it was like one of these lies that Fogoshes are always telling. She was saying, "You said to me you had a cold." Absolute lie. Or intellectual dishonesty. There's no way. You see how horrible that is? She's saying that I would have come in there with cold symptoms. What? I never would have. I would have phoned 811 and found out what to do. Because I would have been worried I had COVID for myself and for everyone else, for Pauline, anyone else coming in contact. There's no way I would have gone to a hospital. You see how disgusting that is. She's assuming that I'd come there with cold symptoms. Shameful. And the last 2 times I've been there, she's wondering, hey, like, why doesn't he establish eye contact? I can't look at her. I'd show the disgust. Disgust. You seem to be a little agitated. Hey, not agitated. I made that clear. See, agitated indicates, hey, that has something to do with you. No, angry. Angry means something to do with a situation or people in the situation. I am legitimately angry. I'm getting disgusted with it. You see the inconsistency? Someone is in there for over an hour, snuffling, coughing, hacking, with the mask down. I put the mask up and I suffer from it.
Yeah.
And they don't do anything for an hour. What is going on here? I'm tired of getting treated like a doormat by the medical profession or the unprofession. It took them 8 years and 10.5 months to diagnose me. And I was giving them a whole list of symptoms. And they all were legitimate. And they were dismissing it. They were dismissing them. I was saying, you're dropping symptoms. No, you're making them up, was what they were suggesting. You don't make up multiple myeloma. I've got 5 fractured vertebrae because they didn't treat me. They were dissing me, disrespecting me. Shame on you, the 10 doctors that I saw in those almost 9 years. Shame on you, you useless pukes. If you had offices funded by the public, you should have been paying rent on those things instead of drawing money out of our pockets. I am tired of you. I'm tired of being disrespected by you. Shame on you. You know, they're talking about closing down the Lethbridge Police Service for some awful things some of their officers have been doing. But they should close down Alberta healthcare. You lock, stock, and barrel. Absolutely, and get some new people.
What do they plan on doing with the police?
They're actually talking about closing down. I presume they bring in the Mounties to take care. There are places that are bigger in Alberta that are served by the Mounties. Red Deer, for example, apparently.
Okay.
Grand Prairie's getting close to Lethbridge. I think Fort McMurray's the same way, maybe Medicine Hat. So,
all right.
Close them down.
Don't close healthcare down.
Get some new people.
I think what should happen during COVID is there should be an emergency due to pandemic called, and the military should handle all COVID cases. So they should be training new doctors. The military should be training lots and lots of doctors, lots and lots of nurses, lots and lots of lab technicians, and they should handle all the COVID cases. And then the hospital system can go back to handling patients, or maybe start handling them properly in many cases, because I think it would be harder for you to find somebody that's experienced in age, like maybe 40 years plus, that has had no mistreatment by the healthcare system. It'd be harder for you to find somebody that is over 40 that has not been mistreated by the healthcare system.
Multiple times in many cases.
Than somebody who hasn't.
And if you haven't been mistreated, someone who's near and dear to you will have been.
Yeah. So I mean, it needs to be reformed. That's for sure.
There should be a threat of closing them down.
They're collecting big wages and by taxpayers, and
they
are
best
not
doing nothing,
doing the job. In many cases, they are making the health of the public that go to them for help. They're making their health worse than actually making it better.
I had 3 doctors. Wow. I was in the 3 doctors while I was trying to get them to treat me, instead of mistreating me or maltreating me, prescribed stuff that would have killed me with a multiple myeloma. 3 of them. I'm going to mention their names. Dr. Steve's here in Lethbridge, Dr. Strong, and some flunky who was working with Dr. Strong back in the spring of 2011 in the emergency department here. I'm going to name them. You come after me, you pukes. You'll get your day in court.
Please don't.